Okay, so imagine an illness that's a true master of disguise, one that can show up looking like dozens of other things, everything from arthritis to Alzheimer's, an illness that can just hide out in your body for years, quietly causing all sorts of problems. That's Lyme disease. They call it the Great Imitator, and today we're going to unmask it. So that's the big question, right? How can one tiny little bacteria cause a sickness that mimics MS, fibromyalgia, and so many others? What is it about this disease that makes it so incredibly good at hiding in plain sight? That is the puzzle we are going to try and solve today. I mean, just look at this list. This is exactly why it earned that nickname. The number of diseases Lyme can look like is, well, it's just staggering. We're talking MS, fibromyalgia, even things like ADHD. And you can see how each one of these shared symptoms could be a wrong turn for a doctor, a diagnostic dead end that can lead to years of confusion and suffering. All right, so to really get to the bottom of this mystery, we have to go back to the scene of the crime. We have to start with the bite. Let's meet the tiny little culprit behind all this chaos. So at its core, Lyme is a bacterial infection. But listen, this is not your average bacteria. It's a special type called a spirochete. And the best way to picture it is like a microscopic corkscrew. That spiral shape is its superpower. It lets it literally drill its way through your body's tissues and hide from your immune system. And that's exactly how it spreads from a simple bite to a whole body problem. And this is the delivery system. The bacteria gets into you from the bite of a deer tick. Now here's the really scary part. See that tiny thing? The nymph stage of the tick, which causes the most infections, is no bigger than a poppy seed. It is so small, you could have one on you and never, ever know it was there. But here is a little bit of good news. There's a window of opportunity. That tick has to stay attached to you for about 36 to 48 hours to actually transmit the bacteria. So you've got a little time. That's your chance to find it and get it off before the infection can really take hold. So what's the first thing you should look for? You're probably picturing that classic bullseye rash, right? Everybody's heard of that. But what if I told you that waiting around for a perfect bullseye is one of the biggest and most dangerous mistakes you can make? In the very beginning, stage 1, the infection is still localized right around the bite. The classic sign is a rash called erythema migrans. But here's the catch, and it's a big one. Up to 30% of people who get Lyme never get any rash at all. That's almost 1 out of every 3 people who are missing the single most well-known symptom. And this right here, this chart just shatters that bullseye myth. You see that classic target pattern? Turns out it only shows up in about a quarter of cases, maybe less. The vast, vast majority of Lyme rashes are just a solid, expanding red patch. It might look like a weird spider bite. So if you're waiting for a perfect bullseye to appear, you could be waiting way too long. Now, along with the potential rash, you might just feel awful, kind of like you have the flu in the middle of July. You're exhausted, your head is pounding, you have chills, your muscles ache. But here's a little clue that it might not be the flu. The pain often seems to wander. It'll be in your shoulder one day, your knee the next. And you probably won't have the cough or stuffy nose you'd get with a real flu. So what happens if you miss these early signs? Or if you never got a rash to begin with? Well, those little corkscrew bacteria don't just stay put. They go rogue. They get into your bloodstream and spread everywhere. This is when things get much, much more serious. Once it disseminates, Lyme can launch an attack on your nervous system. And this can cause everything from meningitis to shooting nerve pains to something called Bell's palsy, where one side of your face droops. And here's a really critical clue for doctors. If both sides of the face are affected at the same time, you should be thinking Lyme first. That's a huge red flag. The bacteria can also invade the heart muscle itself, causing something called Lyme carditis. This can seriously mess with your heart's electrical system, making you feel dizzy, lightheaded, or short of breath. And listen, if you actually faint, that is a medical emergency. You need to get to the ER right away. And remember that joint pain we talked about? Well, it changes over time too. In the beginning, it's that fleeting ache that just moves all over your body. But if the infection is left untreated, that pain can settle into one big joint, usually a knee, and cause severe, painful swelling. That's full-blown Lyme arthritis. But for some people, even after they've had a full course of antibiotics, the battle isn't over. Their symptoms can linger for months or even years. This brings us to the very complicated and controversial world of chronic Lyme. For up to 1 in 5 patients, the symptoms just don't go away after treatment. They call this post-treatment Lyme disease syndrome, or PTLDS, And honestly, it's one of the biggest puzzles in medicine right now. Why does this happen? Is it an autoimmune reaction that got switched on and won't turn off? Is it just leftover bits of bacteria causing inflammation? Or could there be persister bacteria hiding out somewhere in the body? The truth is, we just don't know for sure yet. This quote from a patient, it just paints such a vivid, frustrating picture of what it's like to live with this. The symptoms are a moving target. It's a relentless and totally unpredictable battle, day in and day out. So with such a sneaky and complex disease, how do we fight back? Well, it all comes down to defense and diagnosis. But as we're about to see, the very way we test for Lyme creates this dangerous, frustrating paradox. Okay, here's the paradox. The absolute best time to treat Lyme is right at the very beginning. But our standard tests, they don't actually look for the bacteria itself. They look for the wanted posters that your immune system puts out, the antibodies. And it can take your body 4 to 6 weeks to make enough of those antibodies to show up on a test. So you see the problem? By the time the test is finally positive, the infection has had weeks to spread. And this chart just lays out the problem in stark numbers. In that early stage, when treatment works best, the test is a coin flip. At best, it misses more than half of the cases. But later on, when the disease is more established, the test is almost perfect. So the test gets better as the disease gets worse. It's completely backward. And all of this is why prevention is absolutely everything. Seriously, use a good repellent, treat your clothes and gear if you're going to be in the woods, and do a thorough tick check every single time you come back inside. Your best defense against Lyme is to simply never get it in the first place. So, what if you do find a tick on you? Should you run out and get antibiotics? Well, the official guidelines say maybe, but only if you check all 3 of these boxes. 1, the tick is the right kind, a deer tick. 2, it was on you for more than 36 hours. And 3, you live in a place where Lyme is super common. If you don't meet all 3 criteria, the typical advice is to just watch and wait for symptoms. Lyme disease truly is a master of disguise. It imitates, it invades, and for some, it just lingers. And while we are getting better at spotting the clues, from the unusual rashes to the chronic symptoms, the question still remains. Are we getting good enough and fast enough to unmask this great imitator before it does its damage?